Welcome back, welcome back, welcome back to the VET S.O.S podcast. Remember, you do not have to drown in this here transition. You grab that VET S.O.S lifeline. We're here to help. And now it's time to cut through the noise because sitting on the stoop, now she came over, she was over on the other channel, on the main channel, but I said, hey, Ash, I need you to come over to the scoop so you can sit down on the stoop and we're going to talk about this information that she just shared some phenomenal numbers. I was like, wow, I didn't even realize we have this in our community that's at such a high rate. So we're going to be talking about a battle that doesn't end when the uniform comes off, because many veterans, the next fight isn't overseas, it's personal. Our guest, Ashton Kroner, represents a powerful mission through the Veteran Cancer Network, an organization dedicated and supporting veterans and their families as they navigate cancer care and recovery. This conversation is going to be more about transition, mental health, and definitely advocacy. The strength it takes to face a different kind of enemy. It's going to be about family and making sure no veteran fights alone, because the mission didn't just end, it changed. Now let's dive in. Ashton, how you doing today?
It's Friday. It is beautiful. Well, it's Friday on recording day at least.
Yeah,
But yeah,
yeah.
no, I'm loving life right now.
And this is great. I just want to say thank you for coming over to sit on the stoop so we could get the scoop of the Veteran Cancer Network and every great thing that you're doing for the organization, and actually highlighting your network that's starting to grow large, right? Because it's something we talked about on the other show, that it was only two, right? Two organizations. Your
That are
org-
focused on that are focused in general terms, that's not like a specific for veterans with cancer where it's just Navy, just Marine Corps, or just post 9/11, but two that is, right now that we're able to find that covers all eras, any discharge status of veterans with cancer. But there are more that are coming out there. They're just a little bit more focused than what we have.
And that's perfect, because before we start, I know a little bit about you from the last on the main channel, but I know some people sitting on the stoop right now have they have their drink, or we have our water. I have my water, you have your drink, and they say, let's sit on the stoop and let's get this information, man. So what's the scoop on you? What's the scoop? Let's dive into that a little bit before we carry on.
Oh my gosh. So, small town Texas country girl that joined the Marine Corps in 2007, right out of high school, wanted to, join the best branch out there, at least that I could find. And I just happened to be in the Marine Corps, sorry for the other branches. Deployed to Iraq, Afghanistan. I got to serve on Team Lioness, which was such a cool experience. I was with the infantry for a little bit. And then got out of the military, was on the struggle bus, thought I knew everything, found out real quick that is not the case. And, now I'm working in the nonprofit space. I focused a lot of my time in PTSD and TBI, but I switched over to cancer after my husband's diagnosis. I think he just wanted some of my attention more than what I was giving him. So he decided to go and get a diagnosis that I couldn't ignore.
So he got the diagnosis, and during this time, were y'all already overseas, or you was back stateside? What was that environment like at the time when you? Because I'm sure when you heard that, got that diagnosis, like everything just came to a screeching halt. Like, whoa, what's going on? Like, what you mean that we have this?
Yeah.
And so, can you walk us through that?
Yeah, so I was actually out of the military, so was he. This was back in 2021, so this is right around the COVID, time. I was working at Rush University Medical Center at the Road Home program, which was a PTSD program for veterans and first responders. And he had been complaining of back pain for months. We had actually started our own landscaping business, and he kept on complaining, my back's hurting, my back's hurting, and I just thought it was muscle strain or he was trying to get out of hard work. Come to find out, he was actually, going through stage 3A testicular cancer, which it only goes to 3C. So, but that getting that diagnosis, it was really rough, because he had been going to and from the VA. And nothing negative about the VA. It's just, they're overworked and, they don't have enough physicians to really be able to focus on veterans. So when somebody comes in that's young and healthy, there are times that symptoms can get ignored. But my husband and I, when he got that diagnosis, he had I think he either texted or called me and he said, "Hey, I have cancer," and I'm like, excuse me, because he had been in the hospital, that night just going in through the emergency department. So I thought he was going to come back with, muscle relaxers like normal, and come to find out it was, that dreaded C word. And so our life got, upended. I was working full time. I was traveling, nationally, and I was on the international circuit for, a TBI program that I was volunteering with. So, it very quickly kind of just halted everything that we were doing, what we knew. And we had to focus on obviously getting him healthy, but reconnecting as a couple as well, because I didn't realize at the time, and he didn't either, but, work, life, everything kind of, gets in the way of people's relationships. And so we were able to refocus on, what matters most. And that was our relationship, and, basically getting him healthy.
Wow, so that was in 2021, and now we're here in 26. The mission, why you think it's so critical right now to start pushing out, because we had that conversation about the numbers, and if you could share the number, because you say you did some more research and you see like it was even more than we talked about before. I'm like, how is this even possible? How is the community, like, I didn't even know about it till you just shared it. I was like, that's a lot.
Yeah. So, statistically, 1 in 3 males and 1 in 4 females are going to have cancer in their lifetime. With the veteran population, you're looking at a 30% increase. And that's just because of what we were exposed to, in the service, whether it was through water contamination at Camp Lejeune or the other bases, being out in Iraq or Afghanistan and being around the burn pits. But there's a lot of things that service members are exposed to. So we have a much higher risk. Now, only 9 million veterans are utilizing the VA, VA services. So tracking data when it comes to veterans' health is actually quite difficult because, you have three different silos. You have those that are in the active duty or, currently in the military serving their country. They have one silo of information that is getting, put it in for records and, for data and research. Then you have the VA side of the house, but then there's a subset of group that is not in either one of those, and they're going through civilian, healthcare. So it's really hard to identify, a problem if none of those systems are talking, and a whole subset of, veterans are not even being identified in the healthcare system. But what we do know when it comes to the VA numbers is, you're looking at about, 54, 56,000 veterans are getting diagnosed each year with cancer. And if you break that down to a day, daily, you're looking at over 140 veterans getting diagnosed with cancer each day, give or take, depending on the day. So that number is quite staggering if you think about that. And the resources that are out there for them, there's areas of improvement. There's areas for opportunity here for, to be able to help out this population.
And what are some ways because I shared with you my connection with cancer, my mom being a two-time survivor, and I'm real nervous about going for a testing, right? Because it's like, hey, just go take a blood test. We doing something here in June in the DC area, and that. So can you explain with the blood test? I know is different type of cancers. Like, will the blood test for all types or just certain variants, or how would that work out?
Yeah, absolutely. So there is new technology that's coming out every day. We see it all the time with AI, with, other protocols that are coming out. You hear about these, different treatment options, that otherwise weren't there. And so one of the things that, we're taking a close look at the Veteran Cancer Network is early detection. And so there is pharmaceutical companies, multiples that are actually developing a test called the multi-cancer early detection blood screening. It's a simple blood test. It's one vial of blood that's taken, and then it's put through, a screening process to, identify, cancers at, various levels, whether it's stage 1 to stage 4. Obviously, stage 3 and stage 4 are the easiest to identify, within the blood. Stage 1 and 2 is a little bit harder. But this emerging technology is actually quite exciting because you can go and get screened for over 50 different cancers. That otherwise would not have screening protocols that are out there. And it's important to look at that as an opportunity to have a better screening option whenever you're going to your healthcare provider. Right now, the only cancer screenings that are available are for people over the age of 45, and that's colon cancer. So you go and get your colonoscopy at 45 or 50. They actually just lowered that age. Then you also have your mammograms for, for females and males that are, prone to breast cancer or, doing the self-examination, and you have prostate exam. Those are the only three screenings for cancer that are, out there on, that are standard. Oh, and sorry, and cervical cancer, but really it's those three that are common out there. But there is so many different cancers that don't have, standard screening protocols. And that is where the MSED test can come in and assist, doctors and nurses and being able to identify, options of better screenings.
So is that somewhere where somebody could go to their local doctor? Because I know you're based out of Florida, and
Mhm.
like say if somebody in Seattle or Texas or North Dakota, can they just go into their primary care and just say, "Hey, I like this test," or do they have to contact the Veteran Cancer Network or maybe go through a specialized organization?
Yeah, so there are, various ways to be able to get this. Now, this is not actually FDA approved across the board. It is FDA approved through the TRICARE side. So if you have TRICARE for life, you can go to your provider and say, I would like to be able to get the MSED test. I know that one of the organizations that, that we have, a relationship with is the Grail Gallery test. Highly recommend them because they're a part of that TRICARE, TRICARE for life. But then there's also studies that are being conducted. I know the VA just concluded their Pathfinder 2 study. But then we actually have a partnership with Dana Farber Cancer Institute, and it's the Sentinel study. And for veterans that are over the age of 45 that have been to the VA in the last 5 years, and have served at least 4 years, you're eligible to get the Sentinel study. And that is on our website, theveterancanternetwork.org. What they'll do is they'll actually send you the test, and then you can go to your local phlebotomist to be able to get the screening. And then within 2 weeks, you'll be having your results. If you're positive, what is great about the Dana Farber Cancer Institute is they'll do follow up with you. So you have the option of going to your local VA, or they'll actually work with you and coming out to their organization, out at Dana Farber, for basically follow ups and then even cancer care as well.
All right, you talk about cancer care. So how does the policy play into factor? It's you said TRICARE for life, and I'm sure it's different policies that's going up for review and maybe being part of the regular annual screening. Because usually sometimes veterans, we only go on for our annual assessment, right? Just to make sure everything is taken the right way. But I know, can that be like placed in our annual assessment just as like the regular blood work where you're going to do your annual checkup?
That is something that we're actually pushing for at the Veteran Cancer Network. We're actually bringing in a network of providers and other nonprofits to, basically educate Congress, on this initiative, in itself. Ideally, I would love to have this a part of, the annual health screening, when you go to the VA, or heck, it doesn't even have to be the VA. This could be for anybody. But being able to get the MSED test, once a year so you can test those levels. Now, I know that when it comes to the government spending, they're going to take a look at that and be like, wow, that's really costly to send to 9 million people. However, if you look at the cost for cancer versus, the screening tests, I mean, it's a no brainer. Being able to get a stage 1, stage 2 diagnosis versus a stage 3 and 4, it's going to, cost the government a lot more money, the later that diagnosis. Um, so ideally, that's what we would like to be able to have. But, those that are registered on the burn pit, that's what we're really pushing for. Those that have had those exposure history that's already well documented, we want that to be a part of their, annual health exams. That's what we're really, really pushing for. And hopefully when this, is actually approved, federally, through the FDA, that'll just be able to, just slide right into the VA as a part of their annual care.
And actually, I know I had some veteran supporters, right? So, as along with your show as well, as a lot of veteran supporters that come on that listen, that share our content with other people, just so we could, vocalize and maximize it. So, what about veteran supporters? Are they able to utilize like your service, or are you able to direct them somewhere else where they could get this testing?
Absolutely. So we do sit there and direct them. We have all of this information on our website. We want this to be, open for absolutely everybody, especially the families. Also, cancer, it doesn't just impact the person going through it. That is a family battle. And my husband will sit there and say this as well. But He thinks that he had the easier bout, of actually going through, the chemo and the orchiotomy surgery and everything else. He thought that that was easier than, watching me go through it as a caregiver. And I will sit there and say, no, he made chemo look really easy. I'm kind of jealous of that, but we want to be that support for everybody, and we have so many different collaboration efforts with a lot of different organizations across the spectrum, whether you're civilian or whether you're veteran or active duty military. We will not turn you away. We will at least find, the proper resource for you in order to be able to get that. But for those that are looking at getting this, the test is $949, right now. So you can go on the website and be able to sit there and apply for it, yourself if you're looking for that assurity and you don't qualify for some of these other programs.
Qualify for some of the programs is so when I got first, I was a young kid, and my mom, she came and said, "Hey, make sure you're gonna be there for your sister." I'm like, "Mom, what are you talking about?" I think I was like 10, 11 years old. I didn't understand at the time what she was trying to tell me. And that was like part of it. Like, I didn't understand as a kid. Like, so that was affecting me in my mental health, right? Because I'm like, man, my mom is, telling me it sounded like she's not gonna be here. She just celebrated her 70th birthday, by the way. So, that's
Love that.
that's a blessing right there in itself. And I just want to get your take in when your husband says like, "Hey, babe, I have cancer." How did that diagnosis impact like mental health? Because I know you said everything. You say he was strong, you were strong. Both of y'all were strong together, right? Because y'all had to team up. Y'all had to start like, "Hey, we're gonna do
Mhm.
this as Team K. Like we're gonna attack this head on. Like hey, you take care of your treatment. I take care of the household. You work on recovery. I make sure you have everything you need." So can you walk us through that? Because I know some people, it's like, man, it's tough. It's tough when you don't know, when you don't have a blueprint, when you just trying to figure it out on your own. But I say I love conversations like this because at least it shows others like, hey, this is what we did, or this is what I applied. Maybe you could take some and use it for yourself.
I think community is huge, first of all, because I mean, there is no way that I would have been able to handle everything that was thrown at us. Because he really wanted my attention because he, was, doing all the things that he was supposed to be doing, but just, how cancer is, sometimes other things pop up. And so, he ended up in the ICU. He ended up with sepsis, actually, where, he was, literally in the fight for his life and spent a week in the ICU. And it was just right around Christmas. And our son at the time, he was, in first grade, so having that conversation with him, he just didn't really seem to understand, what that was. I mean, we were trying every which way we could have, those conversations that were appropriate for a first grader. But it really kind of led down to the community of being able to step up. I mean, we were in Illinois at the time and, there was snow. So people were going out and shoveling our driveway, our sidewalk. And then, unfortunately in Chicago, you have, if you spend a week or two in indoors, like in a parking garage with your vehicle, I mean, there's going to be rats and stuff going into your car trying to find that warmth. So of course, I had a car issue, and so our Marine Corps League came out and paid for, that car repair. I mean, everybody kind of came through and helped us because there's been plenty of times where I was like, about to lose it. And I was like, I don't know what to do. Like, I mean, because you really don't know what to do whenever you're watching your loved one, your partner, your best friend be able to go through something like that. So you really want to be able to focus on like, okay, what can I control and what can I sit there and let go and let other people be able to handle? And I think that was really hard for both my husband and I. Because we like to be able to control everything ourselves. It's like, okay, it's Christmas time. We don't have the Christmas tree up. I need to wrap presents and all that. And so my mom came in, decorated our whole house, did all the things that she could within her power. And that just, it helped with a lot of that mental health. But the one thing that I really wish that, we had been afforded that opportunity was when he was going through, infusions and, he spent hours in the chair, going through that treatment. We didn't really get that access to mental health care. They were so focused on the physical side of things that, they kind of neglected the mental and, moral side. If, when I sit there and I look at, you're going through a devastating, experience like cancer, it's mind, body, and soul, so what can you do on all those, different wickets? And a lot of the times these oncology centers spend so much time focusing on the physical thing that mental health kind of takes a back burner. And that's what we really want a veteran cancer network to be is that resource that we wish that we had when we were going through it, that community where, people understand what you're going through.
And you talk about people understand what you're going through. when the information came to you in 21 and you started to look around for organizations and nonprofits and you seen a gap and you're like, wow, it's no. So can you explain like because I'm trying to see like you say, you know what, I'm gonna start a nonprofit to focus on this right here because it wasn't anything out there that covers it, or the ones that was out there, they was overwhelmed, right? Because if there's only one or two, we have millions and millions of people. I'm sure the line was long. So you was like, well, I want to start something so I could start helping people.
I think the hardest thing about it was because, I mean, there's so many different support groups out there, but they're specific to your cancer. And then for caregivers, it was really hard to find something that wasn't so depressing, because I don't want to sit there and go on a Facebook group or into these groups and just have people crying all the time because you need that pick me up, that lift me up. And with veterans especially, I mean, we have such inappropriate, behavior at times. We have a very dark humor,
Yes,
and that can be
humor.
shocking. That can be very shocking in some of these groups. And so, we would sit there and post things and looking for that community that we were finding. A lot of them were civilians. We would find a couple of veterans in there, and then we had found out about the Hunter Seven Foundation, a few months later. But I mean, we had already kind of gone past it. I was sitting there googling and researching, and we just weren't finding, it's something that was easy to identify. Hey, blatantly, this is what is available. Veterans with cancer, come here. Or even the ones that we did find that were within the VA. I mean, it was a much older population. And again, nothing wrong. I mean, we'll sit there and bring in anybody, but there was a disconnect because we wanted to have those conversations with people our age that had families. Like, how do you handle a teenager and a first grader? That dynamic, because those are two very separate conversations. How do you sit there and talk to your peers that are same age as you that all of a sudden stop talking because they don't know how to have that communication with you? That's kind of what we were looking for with the older generation. They just figure things out, and they're like, well, just
Yeah, that's
just
true.
just go talk to them. And I'm like, well, that doesn't really work. So it was a lot of lessons learned, and that's where we really started identifying that there is a gap. And Hunter Seven Foundation, it's a fantastic organization, but it takes a long time to be able to actually get heard with them. And I think it's just because they get overrun with people reaching out to them, other veterans and active duty military, that it's hard for them to be able to reach out to everybody. And that is obviously an area that we saw that we could actually make an impact. Is be easily approachable. We want to be as transparent as possible, so we put everything, all of our conversations, everything that we're doing is either on social media, it's on our website. We're sharing all of that so somebody can come and be like, hey, this can be beneficial for me. I like this podcast that, Ashton did, and it talks to us. And that's really what we're all about, is making it easily available, even if, we can't get to them right then and there when they first reach out.
You talk about first reaching out, you have your podcast, you have the website, and I'm sure I call them praise reports, right? You got some good report like, hey, if it wasn't for your organization, it wouldn't have been identified at an early stage where we caught it and we, worked through it to where now they're cancer free, or they caught it at the beginning stages or beginning element with taking the blood work or going through your organization.
Yeah, absolutely. I think, whenever it comes to, and I've said this for years, prevention versus intervention, like it's easier to catch something earlier on before things, kind of really hit the fan. And I was working like that whenever I was in behavioral health. It was so much easier to get people when they have that family support. And that's another thing that, we've noticed is, unfortunately with our generation, divorce is very high among the veteran population, but then you impact it with, if you've deployed to Iraq or Afghanistan, or other conflict zones, you have a much higher divorce, rate, in that one. And then you compound it with something like cancer. And, it's very hard to find other caregivers that are going through, with their veteran, throughout the entirety and to, even afterwards. And so for us, we wanted to be able to sit there and highlight that to make it a beacon of hope for people when they were coming through. But, you have to get to them before, like I said, things start getting a lot harder, because cancer is not an easy way to go. I mean, there's been plenty of times where, my husband got, upset or emotional. And he wouldn't mean to. I mean, it would just, he would just kind of, get flippant or, have these outbursts, and totally, totally normal, by the way.
Right, right.
I'm a hard person to sit there and live with, but we were able to sit there and make it work. And we want to have those conversations with people, especially at those earlier ages. So, we want people to get tested, every year if possible, but, especially at stage 1 and stage 2. I mean, the likelihood of recurrence and, just the overall outcome of cancer is so much easier at that stage. Not saying that it's not at stage 3 and 4. It's just, it's a lot easier on the body. For testicular cancer, like my husband had, I mean, you could have just had the orchiotomy, cut the nut out, and just be on surveillance, instead of having to go through chemotherapy or be, like my husband with stage 3A and then have to go through, 3 rounds of chemotherapy. So there's a lot of, benefits of that prevention, that early access to care.
Early access is definitely, I talk about awareness, right? You get like the pamphlets, you get the information, so at least you're aware that here's an option, right? For me, I kept putting it off because it was funny, like you said, a colonoscopy, and I like I don't want to drink that nasty stuff, and I didn't realize is easier ways, a blood test. It just you don't have to, you could just take a blood test. So how can
And it's
early
not, I
awareness
mean,
help?
that's not the only, yeah, that's
Right.
not the only thing, that's good. By the way, they do have the pills for colonoscopy. So always ask for that if you can. So you don't have to take the liquid Drano. But, like I said, when it comes to the awareness piece, a lot of people will push off their symptoms like, oh, it's just me getting old, or maybe I just worked out a little hard the other day, or, I didn't sleep well. Fatigue is one of the number one things whenever it comes to cancer. Not meaning anything about like, hey, I'm tired today, I have cancer. That's not what I'm saying. You got to look at all the different symptoms, but there's some pretty common symptoms, across the board whenever it comes to the different cancers, and fatigue is one of those ones that are really high up there. So you know your body better than anybody else, even better than the doctors. You go into the doctors and you think that, oh, hey, they know everything because they're looking at my medical chart and they're hearing what I'm saying and they just have all the answers. That's a falsity. Like if something is wrong, then you need to advocate for yourself. Sit there and say, you know what? No, this is not my normal. We need better testing that's being conducted for me because I know that this is not how I want to sit there and feel for the rest of my life. And as veterans, that is something that we have a very hard time with. Our mentality is to embrace the suck it up. Don't go to the doctor. You might get forced to actually, heaven forbid, go get a blood draw or a colonoscopy. But you know what though? I would much rather have a colonoscopy every single year for the rest of my life if I absolutely have to, instead of going through stage 4 colon cancer treatment.
Yes, and you talk about advocacy. So I know you and your hubby, y'all about to go on this nice long bike ride. Nice long
Yes.
bike ride. I don't know if y'all gonna take I-95 all the way up, but
Oh gosh, the
yeah.
route's gonna be brutal.
Yeah, so share about that. So I know of course it's gonna be warm, I think in June too, right? Because that's what y'all gonna do it in the
Mhm.
June time for yeah. So tell us about this bike ride that y'all gonna endure.
Yeah, so it's called Pedal for Impact. We are going to be bicycling, pedaling all the way up to Washington D.C. from Green Cove Springs, Florida. So we leave June 13th. It's going to be in the morning, and every day we're going to be riding about 60 to 100 miles a day, and we have stops every single day. We're looking for places. You can go on our website veterancancernetwork.org, and you can see where we're going to be stopping on what days. And if you're in those specific towns, we would love to be able to hear from you. But it's over 1,000 miles. I think it's like 1,020 miles, and that's without the hotels being added in there. But it's all about education and awareness. A lot of people don't want to even hear the word cancer, and we're about to shout it from the rooftops. We're going to be talking to veteran serving organizations, veteran-owned businesses, restaurants, anybody that can, that might be impacted by cancer. Which, again, if you look at those statistics, 1 in 3 and 1 in 4 people are going to be impacted by cancer. We want to educate them on basically the importance of early cancer screening. And then when we get to DC, we are planning that blood draw, like I had mentioned. So we are looking for a spot in Washington, DC to be able to host us for, either 1 or 2 days, June 28th or the 29th. It depends on how many signups that we get. Honestly, I would love to be able to shut the Sentinel study down with Dana Farber. They're looking at, I think right now they have about 500 people signed up for the test, and they have a 1,500 person capacity. And
Oh
how nice would
wow.
it be for us to be able to say by the end of our ride that we can, get them, shut down and complete that study to really look at the research and the data behind, what cancer looks like in the veteran population. But We have a couple of stops that we're really focusing our efforts at Savannah, Georgia. So if you live in that area, please come find us. We have Beaufort, South Carolina, another great stop. Again, military town. Jacksonville, North Carolina is our last big major stop before we get to Washington, D.C. But again, that entire route, we are looking for people to, educate and talk with, and even get into basically the hot seat if they want to ride with us. We'll put them on the hot seat and they can sit there and tell us about their journey in life.
That's gonna so they're gonna be mic'd up and then just be in the hot seat and
They
just
are.
oh, that is awesome. Oh
Yeah.
man. Wow. So check this out. So I've been I seen I looked on the internet, I looked on the website, I got a couple of your podcasts and I just started writing down quotes that you said. One of the things you said, awareness save lives.
It does. If you don't know there's a problem, then, how can you sit there and keep going on through life? I mean, that is I think, complacency we talk about in the military. Complacency kills. That's exactly what that means.
And another thing you said was no veteran should fight cancer alone.
Hmm. There was a veteran that was actually in Texas, and, he's a post 9/11 veteran. He had served his country,
Yeah.
and he ended up with, devastating diagnosis, and he had been in the VA by himself. His
Uh,
family, his friends, they all kind of just left him, and, he had did a heartbreaking post on one of the,
uh,
veteran, Facebook pages, and, next thing you know, I mean, his end of life was amazing, or I say amazing because he had so much community support from the veterans that were coming into his hospital room at the VA. And, that's true because, I mean, this is a hard diagnosis. You don't want to go through this alone. You want to have that community support because, like I mentioned earlier, there's absolutely no way. I mean, we're strong. We could have figured it out, but it would have been a hell of a lot harder, to go through this diagnosis without the support of our community, our friends, and our family.
yeah, and that's why you said community is critical,
Hmm.
critical in healing. Because
Absolutely.
I'm sure what your husband going through is like that human connection, right? It's I was gonna ask you, it feels like because I know I'm thinking about when I was a young kid, by me just coming and hugging my moms and telling her they didn't know what I said, "Mom's gonna be okay. It's gonna be all
Hmm.
right. We're gonna get through this." And I was 10, 11 years old. But just that energy and that transition to power, right? So what's what's the scoop on that, Ash? I'm like, how do you feel about that?
I think the hardest thing through all of this is, I mean, and people don't mean to. When you hear the word cancer, a lot of people sit there and think of the Hollywood version of it is that this person's going to pass away. And a lot of people don't know how to have those conversations, and all we're looking for is just, hey, thinking about you today. Here's an inappropriate meme if you're in the military, like, something to cause us to laugh and have that conversation, but we had, people that, didn't know how to have conversations with us. And that was really, really hard because, we were getting, we used to be invited to all sorts of things, but during that time, and mind you, it's COVID too. But we stopped getting, invited places. People stopped, I mean, not everybody. I mean, there was, like I said, we had a lot of community that helped us, but then there was those that were close to us that just didn't know how to deal with that. And for those kind of, circumstances where people are like, I just don't know what to say, what, that's, you don't have to actually say anything about the cancer. You can just be normal about it. Be like, hey, you know what, today was a, hope you had a good day today. Or, if you're feeling nauseous, then, I saw this tummy thing that my pregnant wife took, and it helped her, like we look for, we look for
Yeah.
that normalcy. And that's what, we really craved is those normal conversations because so much of, that time period was so focused on the treatment and appointments and, looking at lab results and, tracking symptoms that way, it tended to get away from, what was going on around us. And our son, like I mean, he would humble us real quick. He would come back. He didn't understand why he couldn't, fight with daddy anymore because they do like the MMA or, wrestling, like thrown across the couch and everything. And he couldn't do that during that time. So it was hard for him. But, like he came over and, like they had some fun conversations. In fact, one of the things that my son wanted to do, because when my husband lost his hair, he was like, well, I'm going to shave my head. And I was like, well, you don't need to shave your head. I was like, why don't we do a mohawk? So he ended up doing a mohawk during Casey's
Nice.
entire cancer. And it was so fun to be able to see that, because it was, as Casey or as CJ said, he was like, I don't think the other kids in school are allowed to have this. And I was like, well, this is going to be a secret. So it was just, those things made it normal, and that's what we really craved is just that normalcy.
And talk about normalcy, we shared a little bit earlier about mental health. You said is part of the fight, and is that's one thing that probably, like you said, it wasn't addressed. So they was focusing more on the
The
outside, but
physical
like
side.
the physical side, but the mental fortitude and resiliency going through the
Absolutely.
treatment.
Anxiety is real. I mean, very, very real. When you're going through any type of diagnosis, I mean, you're going to have high anxiety, but especially whenever there is a potential death sentence at the end of it. So when you're going through infusion after infusion and you're getting nauseous and you're fatigued, you're tired, and you're sitting in a chair for, 6 to 8 hours a day, knowing that, you're not really sure of the future, and so you start kind of thinking about your life. And, for me as a caregiver, having to watch him go through that, it was hard. And that was the one thing that they did not, really address. Like, lucky for us, I mean, I worked in a behavioral health center at the time. And so I'd reached out to our chaplain. And so when ended up in the ICU, our chaplain came over and was like, hey, I just want to pray for you guys. And we're like, okay, this is kind of weird. We
Yeah.
haven't had to do this in a long time. But it was nice, but that was really the only effect. But if you look back at, just your entire life and all those times that, you were worried about something, to, any degree, I mean, you're going to have that little anxiety, whether it's taking a test or anything like that. But going through cancer, I mean, it's just tenfold, it feels like, and it's pressure. Same thing after the chemo. It doesn't end, after chemotherapy. I mean, you have your scans. So, for the next 5 years, we were going through, the various CT scans and blood work and everything. And we kept on sitting there thinking, like, is this going to be the time that comes back? So we call it, they actually have a term for it. It's called scanxiety. But again, that's something that is not, was not addressed, for us. And so we had to just kind of figure it out ourselves. And, there isn't a book for this, I mean, not one that we were able to find at the time. We just, struggled our way through it. But it was really important. Again, when I say that community, I mean, Casey and I were, each other's community when he was in the ICU. We sat there and we were like, how can we make our lives better? Again, at our lowest point was whenever he was in the ICU and, he was battling sepsis, his heart almost stopped. I mean, it was just a whole thing. And so we were like, you know what? Let's stop talking about all the negative. Let's figure out what we can do right now. It's, after chemotherapy, what can we do? And so we started planning our, post chemo vacation. And I mean, it was something that we looked forward to. And that just had an immediate uplift on our mental health. Cause we're like, you know what? We are going to beat this. We are going to go through it. And then we're going to go to Universal in Orlando and we're going to party our asses off and we're going to drink as much alcohol as we want. And we're going to just have a grand time. And guess what? We did it.
Yes, and that is so when you talked about hope is powerful, was that what you was
Mhm.
relating to when he's like, "Yo, hope is powerful." That's like the diesel fuel in the car. Like that thing will start up, man. That thing just keep going.
Oh, absolutely. Actually, I think there was a study. I don't know if it was done by like Harvard or Yale, but it was with mice. And in the mice, they had, a couple that had cancer. And so they had one mouse that was, separated from the rest. And then the rest of, the other mouse was in, with this little community of little mice family. And what they recognized was, mice that were separated, actually had cancer going faster. It grew a lot faster than the mouse that was with its family and its friends. It slowed down because they had hope, they had family, they had support, that was there to help them. And we're just the same. Like, we need that camaraderie, we need that human element and that companionship. And I think that is what is so important whenever it comes to any type of diagnosis, is having that hope, having that camaraderie, and letting people know, like, hey, today was a shitty day, but guess what? I was able to get through it, and that was our mission in life, is being able to say, okay, hey, let's find one positive thing that happened today, even if it was a complete shit day, the whole day, and we're like, man, it really, really sucks. But at the end of the day, we were able to find that one thing, whether it was, hey, I was able to get up and walk around the block of my house, or I'm not as nauseous and I was able to complete finish, half my meal. Those are all positive and all wins when, you sit there and think about, what what could be happening.
And the great thing about what could be happening is you have on the website, people share their stories. Every voice matters, right? Like, I share my story that when I was a kid, your husband share y'all said you have people sharing stories so people can see it's not just one framework. It's not, it comes in all different shapes, size, forms, people sharing their story because every voice matters.
Absolutely, and it's to let people know that you're not alone. Like, when
Right.
we were going through it, we thought that we were, like, an anomaly, we didn't realize that there were other veterans in our from our unit that were going through their own cancer diagnosis, or other stuff because we didn't really do the buddy checks, and all that. We had no idea what was going on with the rest of our unit until we got that diagnosis, and then we all started kind of finding one another. And I think that's, obviously another important thing is making sure that, you're reaching out to other people and letting them know. But why we started the podcast is we wanted to talk about the good, bad, and the ugly. What was it like when, you were trying to figure out what brought you to the doctor in the first place, and then, that diagnosis, what was it like? I'm sure it was devastating, like everybody else, but how did you get through it to get to the next steps? What was chemo like? Because we want to normalize it. If you look at cancer now, like, just the amount of research and, technology that has been put through it has really been absolutely extreme, in saving people's lives. But most people still have that Hollywood version of what cancer actually looks like, and that is so far from the truth. And so that's what we're wanting to do is tell real stories and also share what are they doing now, because cancer can be a chapter in your book. It does not have to be the whole book. You can get past it and you could sit there and live a fulfilling life.
Yes. And that's where you talked about healing as a journey. It doesn't just stop
Mhm.
after treatment. It's a
Mm.
continuing journey. Because I'm sure, diagnosis came at 21. Here we are in 26. And
Mhm.
y'all out there building podcast studios and and he's building this and building that,
Oh,
and you
I
share the
know.
information that is thing. But when you share with others, like, hey, it's a journey. It's a journey. It doesn't just stop, and we're here together as a community. So what's the scoop on that? When you say healing is a journey, I got my take on it. I want to hear your take on it.
Oh my gosh, there is gonna be days where you are taking, that you're going like a mile, you're running as fast as you can, and then all of a sudden you get that stitch in your side and you're like, crap, and then you see the old lady passing you, and you're like, how in the world? It's a journey. I mean, I've ran multiple marathons in my life and, like there's days where you're like, man, this is a great training day. And then, there is days where like I am struggling. And that's just the same with healing too. I mean, it could be anything from PTSD to having, an autoimmune disorder, whatever. But I mean, you're going to have your setbacks. But the biggest thing is don't let that be the thing that makes you fail. Keep on going, keep on pushing, because tomorrow's going to be a better day. It's definitely going to be better than the day that you're having, or even an hour from now. You want to be able to, again, have that hope and be able to, look for that positive thing. And, when it comes to, these diagnoses, you just have to know that there's going to be setbacks. Case in point, when my husband was, going through chemotherapy, when I say anything that could have gone wrong, definitely was going wrong. I mean, his first round of chemotherapy. I mean, his chemotherapy worked so well that his cancer had shrunk the tumor that was pushing up against his kidney. And this is a grapefruit size, tumor pushing up against his kidney.
Wow.
And it just cut right through, that chemo cut like butter through that. And so I mean, he was able to, have a lot of relief. But then, he went and popped a pimple, ended up going septic or sepsis, and ended up in the ICU that following week. So I mean, what was great that first week, that second week, he was in the fight for his life. And then that following week, was Christmas and we were coming home and spending time with our family. And so it just shows that there's a pendulum whenever it comes to healing, good days and bad days.
What about passion drives change? Yeah, be
You,
compassionate.
yeah, it's compassionate is huge. Compassion fatigue is huge too. I
Yeah.
know I have, that was something that we talk a lot about in the behavioral health field is looking out for that. But watching the person that you want to do life with go through something like that. I mean, all I could sit there and think of is, man, I wish I was in that chair. And then he was sitting there, it's like, "Man, I'm so glad I'm in this chair and she's not," or, like, it's, like, so, I mean, you have a lot of that for the both of us, but, it's important to sit there and recognize those moments and be able to reach out, whenever you're, like I said, whenever you're needing that help, and don't take on the world, like, it's gonna be there tomorrow, I promise you. So just, take it day by day, moment by moment, and, again, find those positives.
Speaking of finding positive, so how can they find you? How can they connect? How can they meet up with you in the DC area here in June after you finish riding over 1,100 miles? And I know you're gonna be exhausted, but yeah, like how can they connect?
So veterancancernetwork.org, everything that we have is on there. It has our route location, the days that we're going to be there. You can follow us. You can join us, as even if you're not really a big avid biker. We're slow. We have no qualms on that one, but yeah, no, everything is on our website. We're on socials, so we're on the Facebook, Instagram, we're on LinkedIn. We you can find us on Spotify. All of the different ways to be able to learn about our podcast. But if you're looking to be able to support us, we actually have a petition. Again, it's on, veterancancernetwork.org. But just go and sign it. You go look at it, sign it, and share it. That's the biggest thing, because that's really going to let people know about what we're doing, what we're all about. Because we want to make this as easy as possible for the veteran population moving forward. And the best way to be able to do that is through actual change. Last time I think I was on the show, I don't think we even had 500 signatures, and now we're encroaching on 10,000. So that's almost 10,000 people that are supporting
So,
us in our mission. It's fantastic.
oh wow, congratulations. I'm just gonna say this right here. I just share with you, I'm here celebrating my mom's birthday, and just to see her around still after her diagnosis and you know 30 plus years later, and she's still here. And this, like, communication wasn't around back then, right? It wasn't no
Mm-mm.
podcast, it wasn't no, it was basically by word of mouth, right? Or you have your doctor, but if the word didn't spread around. But now we have all this ways to get it out to people, veteran supporters,
Mhm.
veterans, and it just doesn't stop. It doesn't stop here. So I just want to share with everybody, like, please support the Veteran Cancer Network, support Asha and her team, like, support, because the more that's pushed out there. You said 1 in 3, and what's the other number? One in 3 and one in
1 in
four.
4. Yeah, 1 in 3 males and 1 in 4 females are gonna have cancer in their lifetime. With the veterans, that's 30% increase.
Wow. So before we sign off, it's 2026 right now. Where do you see VCN in the next 3 years? Next year,
Next 3
next
years,
six, yes.
well, we have a lot of goals. Honestly, I would love to see that the policies that we're really pushing for, is actually implemented within the VA. Looking
Yeah,
at the, MSED test, a part of the VA, utilizing AI technology and for better screening, compared to what your, exposure history is through through your military service. But ideally, I would love to see Veteran Cancer Network being partnered up with a healthcare facility on actually looking at, how oncology could be treated from the very, very beginning, all the way to post chemo and that follow on care as well. I mean, ideally, that is where I see the future of VCN. But ultimately, what I would really love, you may have heard, the term social determinants of health. Healthcare practitioners use this on identifying risk factors, at a socioeconomic standpoint, but there isn't one for military determinants of health. Imagine being able to go to your civilian hospital or, dentist office when they're asking you, do you feel safe at home? Do you have food? Do you have,
right,
stable housing? But instead asking, have you ever served in the military? What was your job? What was your, where were you stationed?
right.
Imagine the research and the data and being able to identify actual veteran issues at all levels and being able to have that crossover of information sharing. I think that's going to be huge. And that right there is what we're really pushing for, is better understanding of the veteran issues across all platforms.
Wow. Thank you for doing your part, for being the sand. I tell people, look, Look, just be the same. You know, like you ever have like I'm looking at my laptop right now, and you just pour sand on the keyboard, and you see the sand will find all the places where there are gaps, and that's what you
Yes.
and your team is doing. You know that's what y'all doing. That's the way I look at it. Y'all are the sand right now to fill in the gaps. So I just want to say thank you on behalf of VET S.O.S, on behalf of the listeners and the viewers, and the behalf of individuals that have not heard about this podcast yet, that's going to come across it years down the road, and then they're going to look it up, Veteran Cancer Network. Oh, wow. They doing another ride? Oh, this time they going from the east to the west coast? That's a long, I'm going to meet them here. So,
Might actually do that too.
oh, wow. That is, woo. That's a long ride. That's over close to 3,000 or 2,400 miles, give or take.
We've talked to a few people. Actually, Jay Collins, he's running for governor of
Wow.
Florida. He's an amputee, served in the military. I think he was special operator, but he did that. And I was actually talking with him. I was like, hey, this is what we're planning on doing. He's like, well, actually, I went from California to New York. And I was like, I ain't that brave yet. And he was like, well, I did it with one leg. And I'm like, okay, show off, like, but I mean, there's so many veterans that do that, and they're able to bring so much awareness to their causes. He did it for PTSD. We're doing it for cancer, so I mean, there's definitely an opportunity. If anybody wants to join us, like I said, we would love to be able to sit there and maybe bunny hop a little bit. So it's not entirely
Yeah.
on us, but we'll be there either way.
Awesome. Thank you so much. Thank you for coming in. Remember, you do not have to drown in the sea of transition. You grab that lifeline, cut through the noise, reach out to us, reach out to us. We here. We love you. Until next time, everybody, take care. Peace.